Third quarter training for Benicia emergency response teams focuses on triage and emergency medicine.
Begin treating the reds first. Start treating the reds right away. As soon as you find a red, treat that person. If you walk up to the first victim and say, "How are you doing?" and they don't respond, you look, listen, and feel, and you don't hear any respirations, you feel for a pulse and you don't have any pulse, start treating that person right away. Do a head tilt, chin lift, and see if that will clear the airway and if they'll start breathing. You can do that twice. If they still don't, tag them as black and move on. You could save lives if you keep moving. Document your triage results. You may have a walking wounded who can help you with the documentation, and we'll show you how to do that. It's very simple. Just take a little card or paper, anything that you have, and start documenting. What are you documenting and why are you documenting? You're documenting the type of injuries that you have, whether they're immediate or delayed, or whether they're dead. Why is that important? Because there's going to be a second responder. The ambulance and the fire paramedics that are going to arrive when you call 911 or when they hear of the incident. They need to deploy resources effectively. They need to put trauma surgeons in trauma rooms on call. They need to find us where we are and put us on call. They need to tell us how many people are coming in. And they can only do that if there is effective triage documentation. What happened on the 911 event that occurred on the East Coast? Many trauma surgeons were pulled from their trauma centers and gathered in nearby hospitals. Not 1/10 of those trauma surgeons were used for that trauma. About 20% of deaths occurred in secondary trauma situations that happened to happen at the same time because they were ineffectively deployed. There was simply no available information that there would be no trauma victims, that there was going to be just mass mortality, that there was not going to be many salvageable people. To be able to deploy resources effectively and avoid secondary deaths occurring in other situations, you need to do documentation. As soon as you arrive on the scene, you should be able to document how many people need rapid intervention, so that when the person who can transport them arrives, they can effectively have people stand by. You need to be able to say where these people are located. Ideally, you would be able to transport them into certain locations, have an area set up for the morgue, and have all the rapids in one place, but that may not occur. You may not be able to extract people from a collapsed building. So document that there is someone trapped in the kitchen, there is someone trapped in the living room, wherever these people are, wherever these victims are located. So like we just went over the bus scenario, basically you're trying to find three categories. Those people who need immediate attention. The people who need immediate attention are people who have an injury to the airway, they have a bleeding problem, they're in shock, or they have an injury to their brain or spinal cord. The other ones are the delayed injuries. The delayed injuries are not something that you are going to handle. You're only going to identify them as delayed. The victims who are going to have delayed problems are going to be our problem when they arrive in the hospital. They're going to die of infection. They're going to die of multi-system organ failure, for example, liver failure and kidney failure, as a result of the injuries that they sustained. But it's not something that you need to worry about at the time of the initial scene. And of course, you need to be able to identify if they are not salvageable, if they're dead. As rescuers for a disaster, you will not perform CPR. If, however, you have a CPR license and you are responding to a first aid scene or a CPR scene, a single victim, for example, in a car accident, yes, you could do CPR if you have your CPR license. In a disaster, you have a greater number of victims and a fewer number of rescuers, so you will not perform CPR. It takes too long. Has anyone here done CPR on an actual victim? It's very messy. If it's successful, they're going to puke all over you as soon as they wake up. No CPR. Okay, document triage, and this is the reasons why we document triage. You need to have effective deployment of resources. You need to know where these victims are located so that the second stage responders like the paramedics and the firefighters will be able to extract them quickly. Just make a very simple, quick record. Okay, we're going to start talking about specific killers, the airway obstruction. So the passage or the airway begins behind the nose and the mouth and goes down through the first part of the airway, which is called the pharynx. Then it goes on down to the next part that's called the larynx, and then it gets down to the trachea, and then it gets down into the lungs. That's the airway unit. And the obstruction occurs right in your mouth from the tongue. The tongue is fixed at the base and is free at the tip. If you're unconscious, most likely your head will fall forward. As your head falls forward, the tongue goes back and obstructs the airway. So all you need to do is to do a head tilt, chin lift, pull the jaw out. The tongue is attached to the jaw. It will move forward and will clear the airway.